Hello. Thanks for tuning in to this video that's going to talk about Medicare and some important savings programs for folks who receive their Medicare benefits. I'm Susan Spilly with the State Health Insurance Assistance Program, otherwise known as SHIP. SHIP is funded by the Administration on Community Living and the Indiana Department of Insurance. Our purpose is to provide free and impartial information on Medicare. We have counseling sites all over the state of Indiana. Now, most of those are closed right now, but we stand ready to answer your phone calls live at 1-800-452-4800. And we'll be happy to talk to you from 8 a.m. to 4:30 p.m. Eastern Time. So if you have any questions, do please call us. We would love to help you answer Medicare questions. All right, let's get started talking about our important money-saving programs. Well, the first group of programs are called Medicare Savings Programs. These are actually Medicaid programs, but they're only for Medicare beneficiaries, and they allow folks to have more income and more assets than traditional Medicaid does. The biggest benefit plan will pay for your Part B monthly premium, which is being taken out of your Social Security check. It'll pay for all of your co-pays and your deductibles when you're going to the doctor or if you have to go to the hospital. So basically, if you qualify at the highest level of the Medicare Savings Program, you wouldn't have any or hardly any out-of-pocket medical costs. What happens is Medicare pays its share, and then Indiana Medicaid picks up the rest, as long as you go to Medicare and Medicaid providers. So this can be thousands of dollars of savings every year. There are two other programs under the umbrella of Medicare Savings Programs, and both of those cover that Part B monthly premium. So even though that's not as good as having all of your medical costs covered, having that Part B monthly premium back into your Social Security check can really help you, especially when you look at it for a year. It really does add up. So, what are the qualifications for these great programs? Well, for the one that pays practically everything, the income guideline for a single person is $1,615 per month. That's gross income. The asset limit is $7,860. And your assets don't include your personal possessions or your car or your home or some other things that we can explore with you if you want to call and ask us. Now, if you're a married couple living together, the income guideline for this program is $2,175 gross income per month. And the asset limit for a married couple living together is $11,800. However, the two programs that pay for your Part B monthly premium, and that's the only benefit, you can get up to $1,988 a month gross income and maybe still qualify for that benefit to have your Part B paid for every month. The income guidelines are varied for these programs, and that's why it's always a good idea to call us at SHIP, and we can look over what your income is, your assets, and see if there's a program that can help you. So those are called the Medicare Savings Programs. The application is very short and very easy, maybe takes 10 minutes to do. Okay, so let's talk about the other program. It's called Extra Help. And Extra Help is actually administered by the Social Security Administration. So that application is actually done online on the Social Security website. That app takes about 10, maybe 15 minutes to do. It's super easy, and both applications just ask for very basic information. So what does Extra Help help with? Well, this is all about Part D of Medicare. So it helps pay your monthly Part D, that's your drug plan, premium every month, up to a certain dollar figure. If there's a deductible associated with your plan, well, it pays for that deductible. It also keeps you out of that donut hole or coverage gap, which happens to some people, especially if they take really expensive medications. If you're one of those folks who has a late enrollment penalty, well, it erases that late enrollment penalty and you don't have to pay that anymore. It also reduces the cost of the co-pays. That's the money you pay at the drugstore when you get your medicines, down to $3.60 up to $8.95. So even if you're taking an expensive medication, the most you would pay is $8.95. So that can add up to thousands of dollars of savings, especially for folks who take lots of medicines. So there, of course, are income and asset guidelines for this program as well. So if you're a single person, to get the most benefit from the Extra Help program, your income can't be more than $1,456 a month. And your assets can't be more than $9,360 a month. If you're a married couple, those income guidelines are $1,960 a month with the asset limit of $14,800. Now there's another part of Medicare Extra Help called partial subsidy. And really it's kind of a sliding scale. But the income limit for getting partial subsidy, which means you get a lot of good help, but maybe not everything, that income guideline for a single person is $1,615, just like the other program, with an asset limit of $14,610. If you're a married couple, it's $2,175, $2,175, with an asset limit of $29,160. So this sounds kind of complicated, I know, and I've thrown a lot of figures out to you, and that's why we're really urging you to just give us a call at SHIP. Say, hey, I want to find out more about those assistance programs. We'll ask you some questions, and everything that you talk about with a SHIP counselor is totally confidential, so you don't have to worry about that. And we'll do some pre-screening to see if you qualify. There's also another program called Hoosier RX. Well, by its name, we know that it's just an Indiana program, and it's been around for quite some time. And Hoosier RX helps people pay for their Part D monthly premium, their drug plan premium in some cases. So we can help you look at that program as well. So I urge you to call us. Again, the information is confidential. We are a government service, so you can be assured that we will do our best and not share any information that you don't want us to. So you can reach us. Again, our phone number is 1-800-452-4800. And we're working every day, so give us a call. We'd love to help you. Thank you very much for listening. Take care and be well.